In this section that we used for week 7, we'll be talking about nutrition and the older adult, and also having a discussion on older adult diabetes. In this part of the unit, we talked about digestion of food and the maintenance of nutrition and the age-related senses that can be diminishing, and gastrointestinal changes too that can be changing as the older adult ages, and the potential risk factors that those can result in, and also looking at the functional consequences that occur with digestion, eating patterns, and nutritional requirements. And then probably the biggest risk factor that falls into this class is diabetes mellitus type 2. Now, as a person ages, the ability to taste and smell food declines in older adults, and this is because of a combination of age-related changes and because of risk factors. And your book pointed out that your ability to smell, also termed olfaction, is best at around 30 to 40 years of age. And then from ages 40 to 50, you see approximately a 4% impairment, and nearly 13% from 60 to 70, and well over 39% after you turn the age of 80. Now, considering that some people also smoke or chew tobacco, have nasal traumas that they've sustained, or take certain diuretics or antidepressants, those can all have a bearing on increasing those levels, I should say. So, presbyphagia occurs because the esophagus stiffens and peristaltic waves decrease. And when it reaches the point of forming chyme, we might be doing ourselves a disservice because there's a propensity in our country to decrease the amount of stomach acid that occurs. And that happens again a lot of times with people who are older adults. Some have increases in stomach acid, but more so, probably older adults experience a decrease in it. And a popular medication that's available over the counter and by prescription are proton pump inhibitors, certainly with a very good purpose if somebody truly has gastric esophageal reflux disease, or GERD as it's called, and there'll be more talk about that in pharmacology. But the use of proton pump inhibitors might actually end up being a negative consequence in the older adult. We see decreased absorption of nutrients that's occurring already with changes in the intestinal tract, and that's why you see older adults many times getting Oscal or vitamin B12 shots every so often. Also, the liver is getting smaller and blood flow is decreasing by about a third, partly age-related and partly pathologic. But the liver has a neat ability to be able to compensate for these changes and normally do its part in the digestive process, barring any other things that are occurring that are slowing that process down. So caloric intake should be gradually reduced between the ages of 40 and 50 years, and this decrease in caloric intake requires a proportionate increase in the quality of the calories, the nutritional density of the food that's being eaten, to meet those minimal requirements. Water is really essential for life. The maintenance of your most protective organ in your body relies on water, that being the skin, because without water and good skin, you can become confused, delirium can set in, and your body's process of metabolism and digestion are affected without the use of water. Okay. Risk factors affecting digestion and nutrition really can come about as a result of poor oral care. When a person is edentulous, having no natural teeth, it affects their ability to chew food well, and also becomes a problem in terms of potential infection processes there. The lack of teeth is getting better, but still 25% of older adults ages 75 to 84 are with no natural teeth, and that number increases to 31% with 85 above. Also, decreased mobility can affect the digestion and nutrition process because the person's maybe not as able to get to the kitchen easily to eat as they'd like to be there, resulting in lesser food consumption maybe not getting enough there. And medication and certain lifestyle factors like alcohol and smoking can certainly have a play on that. And I went into detail about how alcohol affects each portion of the digestive system in this slide, and that you can read through yourself there. And we're talking not just having like a glass of wine or something like that, but more so when people are abusing alcohol, the impact that it really can have. So risk factors that occur as a result of poor digestion and nutrition, people can sometimes have more stress, anxiety, and loneliness when they're not having a meal with a loved one. Their spouse might have passed away, and the rest of the family may live out of the area and not be able to participate as much there. Simply getting them involved in a setting, which maybe going to the senior center a couple times a week to have lunches there can certainly help overcome some of those areas. Sometimes environmental factors like they don't like the noise in the restaurants, or the way things are packaged sometimes can make a difference in how well a person eats. And then there's a lot of behaviors that are based on myths and misunderstandings. Constipation in an older adult is not normal, and it's not any more normal on an older adult than it is in a younger adult. It tends to be more so a lack of roughage or fiber in the diet, and sometimes the opposite end occurs. There's really a tendency toward promoting laxative use now and creating what's been an age-old situation of laxative abuse in the elderly. There's a number of foods that are recommended for being cut down on that are shown here. It's important to note number 2 especially, because grapefruit can have an interaction with a lot of different medications. So it's important to be familiar or make your patient familiar with the interactions that could be occurring as a result of that. Then also noting caffeine can affect how well a person sleeps. Oh, didn't mean to play that either, sorry. The amount of sugar in cola can have an impact. Realizing that 1 can of cola has the equivalent of 10 teaspoonfuls of sugar. But sugar-free drinks, sugar like diet sodas, really are not helping any. In fact, they're contributing to weight gain in many people because the body's tricked into storing more, thinking it's being depleted of sugar when in fact there's plenty there. And then alcohol and empty calorie foods sometimes create the same kinds of issues. So some functional consequences that affect digestion and nutrition, kind of in summary here. How well are they able to purchase, prepare, and get to the kitchen to make their food that they enjoy? Are there changes in the oral function as a result of poor dentition? Are they in a poor state of nutritional status there? And is their weight being affected by that? How is their overall quality of life? Sometimes programs like Meals on Wheels, for example, can be a good option for those people there. Then there are pathologic conditions that can affect digestive wellness. As I said, constipation is not normal, but it can be a decrease in normal frequency of defecation that is occurring that makes a person feel more full, and perhaps some assistance is needed that's safe rather than jumping immediately to laxatives. Increasing fluids and having foods higher in fiber certainly can help with that. And there are different types of risk factors that play into place that can affect digestive wellness as well. Mobility, depression, medication reactions can all have plays into that. So really, the nurse's responsibility is to interview about how their digestive process is. Ask them, are you having regular bowel movements? How frequently do you have them? What do they look like? Same way with urination, frankly, too. All kind of uncomfortable topics, probably more so for the nurse than it is the patient, who may be wanting to ask questions. And then using the mini nutritional tool to, as one example, can help you assess, are they getting what they need to meet their needs? So once you've assessed the issues that are occurring, you can formulate your nursing diagnoses there, which could be one of several ones that are very good there. And then start planning for wellness outcomes to help improve the nutritional intake and make sure that they're getting the referrals that they need? Are they having troubles with taste and smell? Are they having difficulty swallowing? Aspiration pneumonia is a real risk for some people, and if they're having difficulty swallowing, there are foods with different consistencies that can be recommended there. How is their body mass index in proportion to their weight? Are they having constipation issues? Keeping in mind that the idea of providing health education is to optimize the level of good nutrition and prevent diseases from occurring because of poor nutrition. And so eliminating those risk factors can actually help create a better outcome and an optimal level of wellness. Some characteristics you might see could be the older adult who has multimorbidities that can be affecting their diet. But one of the most common ones we'll be talking to in the next section is going to be diabetes mellitus. Right back with that.